Hello, my name's Tom Harris. I'm talking to you from Ottawa, Canada on April 30th, 2020. Like most Canadians, I'm stuck at home because we're on national shutdown because of COVID-19. But our governments are flying blind on this disease. They have no idea how many Canadians are infected or what the true mortality rate really is. The shutdown of Canada may be a huge mistake. But before I explain why, I'd like to start with a bit of an analogy. Imagine that following a rash of accidents on the 401 highway, the government decided they had to figure out if they would close the highway to everything except essential services. To determine how safe the highway actually was, they chose to sample a group of drivers who had often used the highway. The survey showed that 3% of them had been involved in serious accidents in the last year. Now, when they plugged this data into their computerized transportation models, they found that they could forecast that tens of thousands of people would be involved in serious accidents on the 401 over the next year. And in fact, there would be a death rate of 5%, according to their models. Of course, if this happened, it would flood our hospitals with emergency cases, and it would seriously compromise our healthcare system. Now, when the survey and the computer model forecasts were released to the press, headlines followed in newspapers across the province. 401 death trap. We must close the highway or thousands will die. Not surprisingly, governments responded quickly and closed the highway to keep us safe, they said. But the consequences of the shutdown were horrific for industries and companies and stores who used the 401 as their vital communications and transportation artery. Also, millions of people were left unemployed, but the government would say, we must listen to the transportation experts or thousands will die. But then somebody noticed something strange about the survey. The drivers questioned for the poll were people who had actually been before the courts with traffic violations. The average, mostly safe and law-abiding driver was not involved in the survey at all. So no one knew what the actual fatality rate really was. The study and the government's actions were based on nonsense. Now, if you think this scenario is too silly to actually happen in the real world, then think again, because to a certain extent, this is essentially what's happened in the COVID-19 health emergency that we're in right now. You see, the federal government says that of the 800,000 Canadians who've been tested for the virus to this point, about 51,600 tested positive. Now, that's about 6.5% of the total number tested. We're also told that about 3,000 people have died of the disease, and that would be 5.8% of those who tested positive. And of course, that's a far higher mortality rate than people who die after contracting the flu, which is typically about 1 in 1,000 or 0.1%. Now, of the total population tested so far for COVID-19, it turns out that about 0.4% of those have actually passed away. Again, this is far higher than the percentage of people who die across Canada due to influenza and pneumonia. And if you think about it, if 0.4% of Canadians die due to this virus, COVID-19, we would see a catastrophe with over 100,000 deaths. And it's exactly this kind of scenario that has frightened people, and in particular led to headlines across the media and the government shutting down the economy, throwing millions of people out of work, business failures, and a society frozen in fear. But have you noticed something unusual about the input data to these models? Just as in the case of the hypothetical 401 accident scenario, Ontario, for example, is only testing people who actually have symptoms of COVID-19 or people that support them, such as in the healthcare workers and also first responders. The general population are not being tested at all. So this means that the government really has no idea of the total number of Canadians who are infected with the disease. Now, when you're calculating mortality rates, that number would, of course, go in the denominator. So what it really means is that instead of 5.8% of those infected dying, as is the case of those who've been tested so far with coronavirus, It could be that there's only a tenth as many or 100th, because the amount of people who are in the population who have the virus and show no symptoms could be much higher. In fact, in Italy, in one particular study, they found up to 75% of people who had the virus had no symptoms. So no one really knows, unless they do a special kind of survey, what the real fatality rate is. And that's what I want to speak to you about. You see, scientists across the world are concluding that random testing across entire populations should be used to get a clear picture of the overall infection rate and the mortality rate of the virus in a nation. By randomly testing a large enough group of people across a region, you're able to get sample results that are indicative of what would happen across the whole country if you could test everybody. Now, this is not rocket science. Okay, this is done all the time in national polls to do with politics and various other fields. If a national random sample was carried out, epidemiologists would learn much more than the total number of coronavirus cases and the virus's fatality rate in Canada. They would also find out the number of people who are infected but not sick. And as I said, that's a crucially important statistic to have if you're going to try to determine how deadly COVID-19 really is and whether a complete shutdown of society actually makes any sense. There have been some cases in the world where they've actually done random sampling. For example, in a hotspot in Germany, hotspot being a place where they had lots of virus contagion, and a hotspot in California, particularly in Santa Clara. They also did it for the complete countries of Iceland and Denmark. And they found in all these cases that the death rate appears to be no more than the seasonal flu rate for people who actually catch the disease. Now, this is supported by studies carried out by a Stanford University epidemiologist by the name of John Ioannidis, who concludes that the World Health Organization has overestimated the fatality rate of COVID-19. So our governments have shut down the nation's economy and ordered self-isolation for millions of Canadians based on the output of computer models with woefully incomplete input data. It's truly a case of garbage in, garbage out on this computer model. Ioannidis makes an analogy of what our leaders may be doing if it turns out, as seems likely to be the case, that the virus risk, the actual fatality rate, is much lower than what people fear. Here's what he said. I'll just read it to you. It's like an elephant being attacked by a house cat. Frustrated and trying to avoid the cat, the elephant accidentally jumps off a cliff and dies. Well, thank goodness, Canada has not died yet. So let's do proper sampling, random sampling across the population before we do entirely jump off the cliff. Thanks for listening to me. If you'd like to contact me, send an email to icsc.tom.harris@gmail.com. Tom Harris, good health to you.